There has been a devastating deterioration in quality of life for Ghouta's population, he said from Syria. The civilians of eastern Ghouta have never witnessed such a battering campaign where, more than 4,200 airstrikes over the city of eastern Ghouta were launched. A city with a total area of 107 square kilometers, about 41 square miles, and 400,000 inhabitants has been battered by more than 4,200 airstrikes. Ibrahim says the ceasefire conditions have effectively been trimmed back to just a 2-hour window each day before military action resumes. He said this was not enough time for aid workers to enter and bring medical help or food. Civilians are sheltering from bombs in inadequate, overcrowded and unsanitary basements. The internal refugees lack the minimal essentials of human life: food, medicine, and clothes. Currently, all the people of Ghouta live in basements, unequipped with the basics needed for living, he said. The basements are prisons for the masses. Such abject lack of cleanliness and health care facilities, such as water and personal hygiene equipment, have led to the spread of epidemics and other related issues, such as lice among children. The shortage of medicine for people with chronic diseases, such as diabetes and high blood pressure, has led to deaths. People with kidney disease are unable to have life-saving dialysis sessions in Ghouta. There is difficulty in burying dead bodies. The city's graveyards are among the targeted areas by the bombardment, which makes it impossible for people to bury the bodies of the dead. In Doma, people had to bury the dead in public parks and in the backyards of houses because it was not possible for them to make it to the city's graveyard. Ibrahim claimed people around the world had ignored the situation in Syria, saying the aid being pledged to, and reaching, eastern Ghouta was an embarrassment to the world. He claimed assistance reaching those in Ghouta was enough for only 6% of the city's population. There is a growing inability of local aid agencies to provide aid to civilians. Food and medicine stores have been bombarded, and the work locations of humanitarian organizations have been targeted by attacking forces, he said, adding that food stores and medical facilities had been damaged. It is an option for people in other countries of the world to pressure their governments and the human rights organizations into taking a collaborative stand against the mass killing of civilians in eastern Ghouta. Their success would save hundreds of thousands of people from the wholesale slaughter witnessed by a motionless world. They are just like any other people around the world. This is what people outside Ghouta should realize so that they can firmly use their efforts to save them and protect them against injustice and killing.